Nowadays, there's so many advancements and techniques in the way that we do cosmetic dentistry. If you're advancing your skill set and you're continuing your education as a dentist in this day and age, you are probably doing very natural looking veneers.
When it comes to cosmetic procedures like veneers, is that something that you're interested in the most, or like what for you is the most compelling component of dentistry? And then what do you see trend-wise where it's going?
Yeah, the most rewarding part of dentistry and what I do every day is being able to listen to my patients and being able to customize the results. So if a patient's coming in and they truly want to optimize their smile, there can be different ways to optimize it, but I'm listening carefully to what that patient desires and why. And that's the beauty of cosmetic dentistry, because there are many people that do want to enhance what they already have and get a natural result. And that's the type of dentistry that I do.
Dr. Mel, thanks for being here.
Of course, thanks for having me.
I'm so excited. So for those who don't know, which is probably everyone listening, I met Dr. Mel when I moved to Miami 3 months ago. I think I've lived here now for 4 months.
Recent, very recent.
We met through this amazing group of women. And before I was moving here, everyone was like, I don't think you're going to like Miami. The women there love to party a lot. They're not really spiritual. And it's quite the contrary. I feel like the women down here, there's such a blend of groups. And the group we have, it's like all women who love to work and lifestyle and fitness and spirituality and healthy eating and lifestyle. And I love it.
Yeah,
It's
that
so
dinner that we
great.
went to, I was so pleased to find such like-minded women.
Yeah.
Because I moved here 2.5 years ago.
Yeah.
And
From New York as well.
I was thinking the exact same thing as you. And not going to lie, I went years without really connecting with many women here.
Yeah.
Also, you know, with the grind of work. But in addition to that, like finding a group of women like that dinner that we went to, entrepreneurial, self-aware, really spiritual women, it's really hard to find. So I'm really happy we met through that. Actually.
I know.
Yeah.
Speaking of work,
Yeah.
why did you become a dentist?
So I was 7 years old. That's the story. The truth is I was watching my mom get 4 veneers done in her upper arch.
Yeah.
And the dentist actually let me go in the operatory and watch her. And no one in my family's a dentist.
Okay.
It was that event that I remember so vividly. I was just so amazed by the instantaneous result and the craft. And dentists are very, very seasoned in artistry. They have to be. They have to work with their hands. And I knew that growing up, that was something that just came naturally to me. One of my hobbies is actually acrylic painting.
What?
And yeah, so I found a love for that, for the craft. And then I also was able to blend in my love for the human body and just understanding how our systems work. And essentially getting my doctorate really required a lot of schooling, and
Sure.
I enjoyed every moment of it.
You actually, okay, so you enjoyed the schooling, because most people
did,
say
yeah.
quite the opposite.
Yeah, if you're going into the medical profession, you have to truly love what you're doing, because
Sure.
it's a commitment that will continuously follow you until the end of your career, which is probably a lifetime.
When it comes to veneers,
Yeah.
so I'm very transparent about the cosmetic work I've done. I have 4 veneers, 2 on upper here and then 2 here.
Okay.
I love them. I am so happy I did it. When it comes to cosmetic procedures like veneers, is that something that you're interested in the most, or like what for you is the most compelling component of dentistry? And then what do you see trend-wise where it's going?
Yeah, the most rewarding part of dentistry and what I do every day is being able to listen to my patients and being able to customize the results. Really, essentially, that's what it comes down to. So if a patient's coming in and they truly want to optimize their smile, yeah, there can be different ways to optimize it, but I'm listening carefully to what that patient desires and why. And that's the beauty of cosmetic dentistry, because there are many people that do want to enhance what they already have and get a natural result. And that's the type of dentistry that I do.
Yes, natural.
And
it
that's
doesn't
what
have to be like big, oversized.
Exactly. It doesn't have to be. And nowadays, there's so many advancements and techniques in the way that we do cosmetic dentistry. If you're advancing your skill set and you're continuing your education as a dentist in this day and age, you are probably doing very natural looking veneers.
Yeah. So what do you think about all these trends where you see women going to Turkey
Yeah.
and the teeth feel oversized? Is that...
Yeah. So the difference
Tell me
is,
about that, because
so
I see that. I'm like, wow, like how is that? But
I've
some
seen
women
it.
like that look as well. And beauty really is in the eye of the beholder.
And this
So-
is where the match between the patient and the dentist has to also mesh. So
Sure.
that's another story. But I've seen patients who actually came to my office and got work in Turkey or in another. Nothing wrong with Turkey, by the way. Just I
I
want to put
love
that out there.
Turkey. I go to Turkey every year. I'm obsessed with
But
Turkey.
coincidentally, you're mentioning Turkey. I do remember a few cases and male cases. They ended up getting full coverage crowns. So the difference between a crown and a veneer is like a thin fingernail. It's
Yes,
like
that's what I have.
zero
Very
point 0.3
thin.
to 0.5 millimeters in thickness. And it goes over the front of the tooth. It hugs a little bit behind, but it's front.
Yeah.
A crown is more invasive. We have to circumferentially drill
And they shave the whole
about
tooth.
1.5 millimeters. Yes.
Right.
So oftentimes, and this is something that we can talk about with ceramics, but we have a lab that makes the veneers. They're custom made. They're hand painted, customized. This
Hand
is
painted?
hand painted. I'm telling you, I've done it in courses and I got to see it is such an intense process to get translucency anatomy. So doing a full coverage crown is actually an easier type of technique for ceramists at times because it's less technique sensitive than a thin veneer.
Sure.
It's easier. So a lot of labs and a lot of dentists in other countries, they'll just go and do a crown on everything.
It's so aggressive.
That doesn't mean it's too aggressive.
It's so aggressive.
So those are the times sometimes where the teeth will look very bulky. In addition to that, if they're not removing enough as well, it could look bulky. So it just depends on the case. But it's the ceramist and the communication between the dentist and the ceramist that gives you a natural result.
And the patient. It's like
The patient's
it's a
desires,
whole,
but I've learned patients don't even know what they really want.
Yeah.
They don't know what they really want. And social media has just given us this like false sense of what is ideal as well. So I think that it's up to us as providers as well to continue to share, to spread awareness about what is being done and why, and to really maintain the health and integrity of teeth.
And when it comes to veneers, I got mine done, I believe, 4 years ago with Dr. Glossman in LA.
Yeah.
Do you know who he is?
No.
I adore him and his family. They're lovely people. And I find him to be such a talented dentist because, again, that like very natural aesthetic, which is what I always desire.
Yeah.
But I remember he told me the answer to this. I'm blanking now because I'm on 5 hours of sleep. But you have to get them replaced as if implants, right? Like eventually veneers do need to be replaced after a certain amount of time, correct?
So implants shouldn't need to ever be replaced unless you
Every
have
10 years, no?
No, implants should not. Those will last
No, I'm
forever.
talking about chest implants.
Oh, breast implants.
Yeah,
yes.
yeah.
I thought you were talking about dental
But like
implants.
teeth, but like teeth,
Correct.
you have
Okay.
to replace them,
So,
right?
So we give everything a timeline of now I can tell you safely with the new advancements and techniques and way that we do things now, 20 years minimum.
20 years.
Yes.
I assumed it was like chest implants that it was 10.
It could be, but that number is so subjective because
And how you take care of your teeth,
depends
right?
upon your oral hygiene at home
Yeah.
and your maintenance in office. You need to be coming every 4 to 6 months at minimum. And when you get veneers,
4 months is aggressive.
No, it's not. It's not actually. Bacteria accumulates quicker on porcelain, so you need to go more regularly to the dentist to get
Learn
cleanings.
something new. Okay, I
You
didn't
can come
know
on
that.
over. We'll take
yeah,
care of you.
actually, because I was going to Glossman and Jen in LA, so now I have to come to you.
So think about,
4
we do a lot of
months.
things quarterly for business, this, that. You need to get a cleaning quarterly. It's just essentially, I think everyone, even if you have veneers or not, it is such a great habit. There is no harm in doing it if you can.
Sure.
Quarterly.
Why did
the
I
reason
think
why
6
6 months is because insurance have drilled that in all of our heads and made it the norm, and it is not true. It's not true.
It's like 4 months teeth, 3 months Botox, nails, hair.
Yeah.
It's like, oh my God, by the time you're done, it's a full-time
Insurance, dental insurance has not been updated since I think the 70s or 80s.
Yeah.
They
That's
just came up with a number.
scary.
It's crazy.
That's
It's so
actually
crazy.
terrifying.
Yeah, I know.
Wait, speaking of oral hygiene, I want you to rate my routine.
Okay, let's do it.
Every morning. Well, actually, let me start with night because nighttime is like more in depth. Floss, obviously. I use the black, like the double pronged, if you will, like the double
With the
wire.
floss pick?
Yeah, the floss pick, but like it's the physical one.
Okay.
And it has the double.
Okay. Oh, yeah, I know what you're talking
wire
about.
versus
Yeah.
like the one.
Okay.
Because I heard that it catches more plaque and
Okay.
and build up. I scrape my tongue.
Mm-hmm.
I Still love Crest 3D white toothpaste.
Okay.
I know it's insanely toxic. It makes my teeth really white. I love it. And then I use a non-peroxide whitening mouthwash. Everything whitening and very toxic for the mouth I always use because I feel like it gets the job done. And then I use non-toxic like on the body, like coconut oil, etc.
Yeah.
But that's my nighttime routine. And I find that the tongue scraping has made a significant difference.
And the whitening product that you mentioned, that's a mouthwash?
Crest, yeah.
Oh, the toothpaste you're saying.
Toothpaste and mouthwash, I use Crest 3D.
Okay. So Crest 3D, I'm not too sure, but when they say whitening, it's usually, if it's in a toothpaste, if they're saying it's whitening, it has an abrasive. So that means like baking soda, for example, or charcoal. Those are abrasives. Think of it as like a sandpaper.
Okay.
So that's
great.
it's removing extrinsic staining. So external staining on the teeth. Peroxide, when you go to an office and you're using the gel, that is an active ingredient that penetrates deep intrinsically inside the tooth. So there's two ways to whiten a tooth. And a lot of people don't realize this, but what you're doing at home essentially with the toothpaste is just removing external stains. So the next day you're
from
going
like
to accumulate
coffee.
it again. Yeah. And there's nothing wrong with it. I think it's great. It could be a little aggressive for some people to use daily, but especially someone with veneers, I think it's perfectly fine.
Really?
Yeah.
Oh
Yeah,
my
it's
gosh.
fine.
I thought there was going to be at least one thing that you're going to be like, no.
No, it's fine. I think it's fine. Just it's
I
important.
remember the brand of the pick grip.
Okay. I'm not familiar with it. So with floss, you want to make sure you're actually curving around the tooth because teeth are conical.
Yes.
So if you're going up and down, you're missing still a whole area.
Glossman taught me that, especially with veneers. You really
a lot of people don't know that too. But, and then the mouthwash, it's just important for patients to just understand what is in the product you're using. At least be familiar with a few ingredients. We don't have to think of everything as toxic. I understand, nowadays.
I want it to work.
There's a lot of controversy with it. I have studied the research and the literature. So you'll be okay. I promise you'll be okay. There's so many new things out there though that are great to use too. It's just about being aware.
What's your favorite products? I know that's probably hard. I hate when people ask me that question.
I personally use Arm & Hammer.
Okay, classic.
And I use TheraBreath.
Classic.
Yeah, and I work with the
one
companies
with like
too.
The orange top with like the shimmery bottle. Yeah.
Yeah, that was part of their marketing tactics. When I had a meeting with them once and I asked them, I was like, why the orange?
Yeah.
They're like, it stands out on a shelf.
It does.
And that's brilliant. It's genius, right? So
a lot of people in LA like that brand because it's like a cleaner version of Crest and
they
whatnot.
have amazing ingredients and it's great. It's honestly so good. They have a very specific ingredient. It's called it's like a chlorite.
Okay.
So sodium chlorite.
Okay.
That actually it's like an oxygenating ingredient. So bad breath, it basically encapsulates bad breath bacteria.
Okay.
So it actually removes the bad breath bacteria. It actually works. This stuff is amazing.
I've heard nothing.
The technology behind it is
brand.
fantastic.
Well, I'm influenced.
Yeah.
On that note, after oral care home, I want to talk about gum. So I still use Trident White because again, anything that's whitening, I'm obsessed with, even though that's really bad for you. So I started switching to Pure.
Yeah.
I
know Pure.
It's like more, what does it have? It's no aspartame.
Yeah.
But the thing is, the flavor lasts 2 seconds, and then Listerine strips I like at night because you're not chomping on gum in front of people. I wish there was a combo of Listerine strips that weren't severely toxic, Pure gum, and Trident White. Maybe you can create it.
Hey, maybe. I don't know. But Listerine, okay.
It's so bad.
There's some products, it's not just Listerine, but there's some products that have alcohol in it. We want to stay away from those because it ruins the microbiome in our mouth and that causes cavities.
Yes.
So I think gum is great. It can stimulate salivary flow actually, which is something that we always want. It's our buffer in our mouth. We need saliva. I think that some gums the claims are not really matched. For example, when they say whitening, okay, what is really whitening the teeth? I told you there's 2 ways to whiten a tooth. So sometimes it's just these claims that don't make a lot of sense, but there's no harm in it. I think those artificial sweeteners, definitely. I think that they can affect the stomach.
Sure.
And also the oral microbiome too in ways.
Sure.
Yeah.
On to the next thing, mouth taping. Dr. Jen is a fan.
Yeah, no, I love mouth taping.
We're both friends with a very famous cosmetic dentist in LA, Dr. Jen. and she is so sweet. She's the best. And I asked her in office, I was like, hey, what's the deal? She also did my Invisalign, which I love.
Yeah.
Invisalign. I'm so over these prongs on my teeth, but whatever. I had asked her about mouth tape, and she was the biggest fan. And it really has helped me not be so puffy in the morning, not be so dry in the mouth. Talk to me about what you've seen study-wise and why you also encourage it, and what your favorite brand is.
Yeah, I think mouth taping is very, very important for the right patient, though. It's not for everyone. So mouth taping was developed to help stimulate nasal breathing. There's a benefit to nasal breathing. A lot of patients actually breathe with their mouth open.
Me.
So when you're a mouth breather, that means that there's something going on with your septum or your airway, usually 9 out of 10 times. And that's the most common issue. So if we're not breathing through our nose, then we're having an issue with the amount of nitric oxide that we're producing in our body. So that chemical we produce naturally when we breathe through the nose, okay? That chemical, nitric oxide, dilates our vessels and allows for us to intake more oxygen and breathe better.
And get deeper REM sleep.
Exactly. So you see how these things are connected. So breathing through your nose is so important. That's why mouth taping for mouth breathers is very important. Because if we're covering the mouth, now we're forcing us to breathe through the nose. That's basically how it works.
Makes sense.
Also, mouth breathers, they're more susceptible to decay, cavities, and other issues because we're drying out the saliva in our mouth, which is also a buffer, which I told you. It's very important to keep a neutral pH in the mouth. When we're mouth breathing, we have an acidic pH in the mouth. A bad environment for cavities, bad breath, all the things.
Makes sense.
So facial structure-wise, in addition to that, I think that there's definitely a lot of benefits to mouth breathing too. There's myofunctional therapy. I don't know if you're familiar with that.
Expand.
There's ways to train the tongue to have better posture. We don't always want the tongue to be at the floor of the mouth. Mouth breathers will have their tongue at the floor of the mouth, and that'll affect and elongate that lower third of the face. So when we have our tongue at the roof of the mouth, and we're practicing that actively, and mouth taping helps, it allows us to also have a more proportionate lower third of the face. So it's all connected.
Which is interesting though, because when you're doing breathing techniques in terms of yoga or meditation, they ask you to drop everything.
Yes.
So
because think of myofunctional as a training. It's an exercise. Up. Yeah, that's why we're actively pushing against the floor. The roof of the mouth. But for different exercises, we want to relax, and that's just a different therapy.
Interesting.
Yep. Yeah, it's like an exercise.
Yeah.
Yeah. It's very cool.
Yeah, it is.
Yeah, but not everyone needs it. So it's cool. If you have a partner, ask your partner, do I snore? 9 out of 10 times, patients who snore are also grinding their teeth at night.
Yes.
A reason for that, our lower jaw shifts forward because we want to get more air. It's something that our body does at night naturally. It's very interesting. And that's why those patients have a lot of wear and loss of vertical height of their teeth. And then they need veneers or they need other therapies. Especially. Grinding 101, it's usually due to airway.
Who do you trust to do your teeth?
Such a good question.
And what have you done and why?
Oh my goodness. Well, I don't officially have a dentist. I think I see my colleagues.
Yeah.
I haven't seen one person routinely in the past couple of years, actually, but I would say Dr. Jen could be my dentist.
She's the best. She's the best.
Yeah, she's great. No, I think it's so different. When you're a dentist, you have to force yourself to remember to get a cleaning, and it's easier though because I'm already there.
It's like I get cleanings frequent, that doesn't have her nails done because she's like, I'm so sick of seeing nails.
Yeah, but my oral care routine at home is pristine, so I'll be fine.
Yeah, you're like, I'm on it. Yeah. What have you done cosmetic wise? Invisalign, veneers,
nothing.
Why, when, nothing.
I got braces when I was 12.
Oh, wow.
And I didn't wear the retainer.
Your teeth are so beautiful. I mean, they should be.
Thank you. I've gotten in office whitening a few times.
Yeah.
And that's really it. It's just, that's it. I don't even wear my retainer. I'm not saying that. I'm not telling people to not wear the retainer.
She's like, I'm not saying
I'm guilty because I didn't have a lot of crowding.
Yeah.
I just had I had buck teeth.
Me
I had
too.
buck teeth. Oh, we went through the ugly duckling stage.
I have to send you my photos. They're so embarrassing. I was ugly duckling.
It's okay.
That's why I got into beauty because no one taught me how to do anything.
Yeah.
I had to teach myself.
I was, I was a makeup artist when I was in college.
I wouldn't be shocked because dentistry, makeup, aesthetics, like
Yeah,
it
it was like my
all.
side gig. I did bridal makeup. So I would
That's
travel to
so
the venues
fun.
and do the bride and the bridesmaids. And that was my first little business venture.
That's so
Yeah. Yeah.
fun. Talk to us about how you were also in the pageant world.
Yes, yes,
It's
yes,
so
yes.
cool. Like, it's so refreshing to see women do multiple things. There's this stigma that if you went to
Yes.
medical school, you don't have to take care of your aesthetic. If you are a teacher, you can't possibly like high heels.
Yeah.
Talk to us about why you would do that, because the stigma around pageant women or girls, depending on the age, is that they're stupid, that they're
Hmm.
floozies, that they're doing it just to parade around half naked, which is quite the contrary,
I know.
especially when we talked about it. Give me like
Yeah.
the takeaway from it.
Yeah. So much respect to the women who actually do pageants. Believe it or not, the amount of effort and training that it requires is so in depth that it actually benefits you as an individual, personal development wise,
Beautiful.
fitness wise, self awareness wise. I had a
Speaking wise.
Yes, public speaking wise, I had a coach for everything. I had a coach for fitness, I had a coach for nutrition, I had a coach for
Wow.
the personal development. So basically, it's like interview. You are only given 2 minutes with the judges. It's a panel of judges. You have to know how to take any question that's asked of you and let them know something about you. And in the exercises, I learned a lot about your core values. And we had exercises with a pyramid in it and talking about concrete examples of how you have exemplified certain traits that you have. No one ever really does that unless you're told to do it. Think
Sure.
about it. Unless you're just born knowing how to journal. I mean, it's really beneficial to have a coach at some point in your life. So pageantry brought that to me very early on. And I had my I joined my first pageant when I was in dental school. Yeah.
That's
I
crazy.
saw an ad and it was on Instagram and I was scrolling and I just had to submit a photo and a one sentence bio. And I
Yeah.
said dental student with wellness blog.
Yeah.
Not kidding. I had a little blog.
And they're like, okay, sure.
And they called me, they interviewed me. They were like, wow, you're going to be a dentist. This is cool. Like we would love to just interview you in person. I came late to the interview. I was
Yeah.
in my scrubs from clinic
Love it.
and it was raining. So I got all like poured on and I just showed up and I was like, hey,
Hey, I'm here.
what's up? And they're like, we really think you have a solid chance at this pageant. And like,
Because they're
we
also
would love to
looking for
have
women
you.
that are intelligent.
Yeah.
It's interesting you mentioned the coaching because even though I coach, like I do a lot of corporate coaching, I do one-on-one coaching,
Cool.
and people ask me all the time, like, what do you do? And I'm like, I have coaches, I have a therapist, I have a coach.
Yeah.
Like, by no means am I perfect. I know spiritual laws. I know how to implement them in lives. I know how to teach very well.
Yes.
It doesn't necessarily mean I know how to implement it within myself all the time. So to have people around you that not only coach you, but can help keep you accountable,
Yes.
even just as friends, it's really imperative to one's growth. I wish everyone could afford not just a therapist, because I think therapists are really good at dealing with the root of the issue.
Exactly.
And coaches are really talented at finding solutions and how to transmute
Yes.
the problem
Yes.
into real life circumstances.
And what you learn through coaching is something that I've learned actually. It's returning back to the self, that
Yes.
self component that a lot of people don't really understand truly, but spiritual women will understand what that is. It's like, who are you at your very core?
At your essence.
And in order to be in tune with that, it takes time,
Mm-hmm.
it takes experience, it takes hardship.
Mm-hmm.
And I think that doing a pageant or doing some type of competition or having a life coach or coach of some sort brings you closer and closer to that. I think even coaches have coaches.
Yeah.
Right?
We do.
So that's a part of my spiritual practice that has brought me to where I am today. And then to hope, like you, to also spread that knowledge to people also in my profession. I've had young women reach out to me. Wow, I didn't even think about the possibility of doing something like that because I thought I just had to be in this box of just study, become a doctor, become a dentist. And your career should not define you.
Correct.
It's only a piece of you in
Yes.
this tree. It's like
Which is why you
it's
actually
like a
have to love
branch.
it, which is why
You
you
have to
genuinely
love it.
have to love it. You're doing it all the time.
Yes. And it's so easy to forget about not only why you got into the career, but also you can become tunnel visioned.
Mm-hmm.
I'm guilty of this.
Sure.
when I was in dental school, tunnel vision the whole time. I left and I did this pageant. I'm being asked questions by my coach. I'm like, teeth. Like, it's like, wait, I don't remember. I don't know what, so it's crazy what it does to doctors and young healthcare professionals. They need it more than anything too. It's crazy.
Speaking of which,
yeah.
How spirituality is so tied to your life, which
Yeah.
is one of the reasons why you and I connected.
Yeah.
What is, and if you are religious, what is your background? What is your faith?
Mhm.
How does spirituality tie into everything? And how do you incorporate it into your everyday routine and your ritual?
Yeah. Beautiful question. So I was born and raised Catholic and I practice Christianity.
Mhm.
So I go to church on Sundays and I actually bring that with me daily because I know a lot of people can go to church and then they forget about the day to day and who are you really praying to and why and what is your direct connection. So I believe in God, a higher being
Mhm.
who created all of mankind and more, the universe. And I think that there's so many synchronicities that are not just coincidences. They are the way that God truly has shaped every event in our lives.
Beautiful.
And it's beautiful to remember that. And prayer is meditation to me.
Yes.
So I've learned meditation shortly after prayer when I was taught at a young age. During adolescence and adulthood, that's when I started to understand that meditation is quieting my mind and prayer is quieting my mind, but also speaking to a higher being that is the truth.
Prayer is a technology. It's a
He is
technology
truth.
to connect to something higher.
And when you are praying to truth, aspiring to be that truth, you become more aware of yourself and truly, why are we here? Why are you here? And to just be trusting in that, knowing that you are here for a very divine reason, bigger than yourself, to live with flow. That is just a beautiful, freeing feeling. I hope that everyone has the chance to feel that and to believe it and breathe it and, embody it.
I love you so much, Mel. It's so refreshing, like by no means is anyone perfect. We all have our things. You do too, I'm sure.
Yeah.
But to find that balance of connection to source,
Yes.
connection to work, connection to aesthetic, connection to well-being. It's just, this is why I do what I do, right? And this is why you do what you do. We want women to have it all. Kabbalah, which is,
that's right.
I'm very spiritual.
I'm familiar with it too.
I know.
And I would love to speak about it.
I know.
Yeah,
and it's so crazy because like I come from a very, very, very spiritual lineage.
Yeah. Yeah.
And it often speaks to women, and everyone can have it all. Who says we can't? And spirituality, it's really, no matter what religion you are, it really asks you to go inwards.
Yes.
And when you can tie that in with your faith, which is what it's intended to do, and work and move throughout your life with that, it's really beautiful. How do you pray every morning? Do you take me through that ritual within your day?
Yeah. Well, when I wake up, I actually read a devotional. I just like part of my routine. Yeah.
How long?
And it was gifted by my best friend. So I'm sorry?
5, 10, 15 minutes?
No, it's just a very quick thing. It's
Nice.
very quick. And then I actually pray at night.
Wow.
I like to pray at night. When I was very, very young, my grandmother taught me how to pray. And as you grow up, you start to just go through life and hardship and you just learn how to navigate. And sometimes you can fall away from that and get so caught up in your goals and, what you need to do tomorrow, what you need to do today, and you forget to recenter.
Yes.
So I think that everyone in adulthood needs to find their connection again.
Correct.
It's just a different world that you're going through. Essentially, maturity changes everything. So as an adult now, I pray at night and I actually pray throughout the day. It just whenever.
It's so funny. In the morning, I do a quick
I don't have a ritual with it.
And then in the car.
Yeah, I pray in the car.
That's
too.
So funny. I do the same thing.
Oh, I love that. No, I just
call
pray
it
when
moments.
I want to.
Just finding pockets
it's
of
a moment.
peace. Pockets
moment.
of recalibrating. And in modern day world, women don't always have an hour to meditate or to pray. I'm like, find pockets. 5, 10, 15 minutes.
I'll tell you what I do.
That's so
ritualistically
funny. I do the same
though.
thing.
What I do ritualistically is in the morning when I'm driving to work,
Yeah.
I have a gratitude practice.
Beautiful.
Yeah.
And words are
Change the
insanely
game for
powerful.
me.
So as you're on your way to
Yep.
work, you're practicing the
I'm
gratitude.
grateful for the ability to practice what I do, to have a job, to go to my job, to just live in my apartment, to go to bed where I'm going to bed. I
Yeah.
mean, it's beautiful.
Yeah.
Think about like where you came from. Like, it's a beautiful thing.
Yeah.
Really.
You are amazing. What
Thanks.
are you working on? I'm like, I love it's so like you really are you attract
Thank
what you
you.
are. And like I really feel so honored and blessed to like attract the women that I have in Miami. It's thank you, God.
Aw.
What are you working on? What's coming up that you're excited about? What can you share? What could you not
Yeah.
share? Like what's the next passionate thing for you?
Yeah. See, multi-passionate individuals have this thing where they just they're so creative, right?
Yeah.
So I myself am a very creative being.
Yeah.
And
what sign are you?
I'm last day of Gemini.
Love.
What are you?
Cancer.
Okay, you're right.
I'm a
after
true
me.
Cancer.
Love that.
Hard outside, very soft inside.
Yeah. I have like Cancerian, I guess, type of energy, right?
Yeah,
I don't know.
very much
I don't
so.
know.
Very
I don't
much
really
so.
understand it to this day, but anyways, so as a multi-passionate person,
Yeah.
I am definitely in the works of some things,
Okay.
which is really cool. And when I go back to the drawing board about what I want to do, it just comes so naturally to me because I always think about every venture that I'm about to partake in. I'm thinking about how I can benefit someone else or a greater mass, which is so cool to think about. Like when people are creating a business and they're only thinking about themselves,
Sure.
it typically doesn't really go very far.
No, it does not.
It doesn't. It doesn't. And it has to be in alignment with your purpose. So purpose is also this word that can be used very freely, right?
Yeah.
Right. So
yes.
what is purpose? That's a whole other conversation,
Correct.
right? Do
And
we all know what our
what
purpose
is it to create? It's to act like
Exactly.
God,
And
to create.
exactly.
And when you create,
that's exactly
doing it for your own self only, you're not
Yes.
creating to add value for the greater good. That's when things
I
get.
think our purpose as human beings is to create,
Mhm.
because that is like God. It's like God
Mhm.
to create.
I actually saw something in a book that I was reading. The less you consume and the more you create, the more you are not just in flow, but you're more in alignment with the universe.
It's beautiful.
Universe, God, creator.
I resonate with that completely.
Right?
And that is what gives me
Less
drive
consuming, less
every day.
consuming and taking and buying
Yes.
and watching and more
Yes.
creating.
Yeah. And that's all I want to do. It's to create. And there's, step by step. But when you have an intrinsic motivator that you can't explain to create a specific thing, you know that it's something divine.
Yeah.
And follow it.
Yeah.
So that's what I'm doing.
Very cool.
Yeah.
So can we talk about what next is up or what you're working on?
Well, yeah, I'm working on a podcast right now that I'm going to launch.
Hopefully you'll shoot it
Yeah.
here at the Move.
Yeah, definitely. So it's going to be me interviewing a bunch of entrepreneurs
Yeah.
in healthcare,
Beautiful.
starting with dentists.
Of course.
But I think it's important for dentists, especially and medical providers, to understand and be motivated that there is more to the chair. There
Sure.
is so much more that they could be doing that they might be afraid to do or not know how to do, or that first step. So to hear someone's story, my goal from this podcast is to truly motivate other people to do something beyond what they think they're capable of.
Beautiful.
Yeah.
I love that. To end on a funny note, I know we talked about this. You've never roasted yourself on ChatGPT.
No, I didn't even know people did this.
It is the funniest thing I've ever. My girlfriend, Iman Hassan,
Yes, I know her.
Yeah.
Yeah.
She was like, we were sitting on my couch drinking wine. She's like, have you ever roasted yourself on ChatGPT? And I was like, no, but I'm very self-deprecating. So please.
Oh my God.
And she was like, let's do it. So
That's
I'll
so funny.
start.
I have to get my phone.
Get your phone.
Here, I'll grab it.
Yeah, get your phone. I'll start to ease it. Have you ever done this?
When you say roast me, you just say roast me?
Roast me, and then I put like comma Liz Kennedy.
Okay, let's do it.
Okay, so I'll do mine first because it's gonna be all right, Liz Kennedy, buckle up, magnetic queen. It's roast time. Oh gosh.
I just pressed roast me, so let's see. Why am I so petrified of it?
It's so funny, Mel. You're out here journaling about quantum leaps, but can't even leap over your unread text. You manifest abundance, then Venmo request your friends for matcha. You say authenticity is the highest frequency, yet you filmed your morning routine from 14 different flattering angles before sunrise.
How does it know that?
Don't know. I've never Venmo requested anyone for matcha. I'm kind of perplexed about that. You've got more retreats than most people have vacation days, and somehow every single one involves sound bowls and a dramatic quote unquote rebirth. You call it magnetism. Your exes call it a gravitational pull for chaos.
Oh my God.
Okay.
This is so funny to me. Oh my God. Okay, ready?
Yeah.
So I just said roast me. Easy. You're that person who opens up 47 tabs labeled focus music, longevity hacks, and how to create the next big business. Then spends 2 hours designing the perfect Notion dashboard for a routine you'll start Monday. You say you love calm, but your idea of calm is speed reading 3 business books, journaling about it, and calling it nervous system regulation. And don't even pretend your morning routine isn't 70% aesthetic setup and 30% caffeine powered chaos. If ambition had a personality, it'd be you wearing silk scrubs, holding a matcha, and scheduling self-care between 2 LLC filings.
Stop.
But hey, at least you're consistent, overachieving, overthinking, and somehow still overglowing. All right, that's fine.
I'm offended.
That was actually pretty nice.
I've never Venmo requested anyone for a matcha. I'm offended. If someone did that to me, I'd be like, keep the $10. Like,
How does Chad even know that?
I don't know.
It's so funny.
So random.
That's good.
You're
That's
amazing.
good.
I'm sure I'll see you like
You
literally
too.
next week.
Yeah.
Thanks for coming in.
Yeah,
I'm so
of
excited to see what you
course.
do, Mel.
Thank you.
You're such
Thank
a
you so
light in
much.
the
You
world.
too. Thank you.